Hello guys, let me to introduce myself. My name is Hesti Handayani and just call me Hesti. I'm a student at Universitas Negeri Semarang, a public health study program. So this time I will discuss the report text that I made about mental illness. Mental illness or mental disorder is a health condition that affects thinking, feeling, behavior, mood, or a combination of them. This condition can occur occasionally or last a long time or chronic. This disorder can be mild to severe, which can affect a person's ability to carry out daily life. Mental health disorders are treatable diseases. In fact, most people with mental disorder can still live life like normal people. However, if the condition is bad, it is necessary to receive intensive care in the hospital to treat the condition. According to the World Health Organization, 1 in 5 children and adolescents in the world has a mental disorder. While in adults, this condition affects 1 in 4 people in the world. As for these cases, about half started in adolescents under the age of 14. There are more than 200 known types of mental illness with varying symptoms and severity. Of this total, the more common types of mental illness are depression, anxiety disorder, bipolar disorder, eating disorders, post-traumatic stress disorder, and psychosis. The characteristics, signs, and symptoms of mental disorder can vary depending on the type, severity, and other factors. This condition generally affects a person's emotion, thought, and behavior. For example, drastic change in mood, experiencing sleep problems, paranoia and delusion and hallucination, change in eating habits, excessive anger, hopelessness, and other symptoms related to abnormal behavior. In addition to mental-related symptoms, secondary to physical health sometimes appear in people with mental disorder. Examples are abdominal pain, back pain, headache, or pain in the other parts of the body for which the exact cause is unknown. Generally, mental health disorders occur due to a combination of various factors. For example, genetic factors, biological factors, psychological factors, environmental exposure factors while in the womb, and other environmental factors. Although mental disorder can affect anyone, there are some people who are at higher risk of mental illness, namely people who are born with brain disorder or have brain damage, people who have families with mental disorder, people who have stressful jobs, people who had childhood problems or lifestyle problems, people who have failed in life, people who abuse alcohol or drug, and people who have had a previous mental illness. Untreated mental and mental disorder can cause a variety of serious emotional, behavioral, and psychical health problems. Although common, mental disorder must be diagnosed by a doctor. There are several treatments that can be done to treat mental illness. For example, psychotherapy, drugs that help reduce symptoms of mental illness, or mental hospital treatment for sufferers who are no longer able to care for themselves. Mental illness treatment can also be done at home. For example, by carrying out therapy as recommended, avoiding the consumption of alcohol and illegal drugs, which can hinder treatment, staying active, practicing a healthy lifestyle, learning to be a positive and focus on positive things, and other things that improve mood. So that's the report text about mental illness. Thanks for watching and see you!